see to really reshape policies and drive change in the approach to women's health. And we've got three really outstanding women to talk about this. This panel is going to be moderated by Charlotte Norgard Langer, and she is going to be accompanied by Henriette Sverre Nielsen and Annette Stenberg. So please, ladies, the stage is yours.
Hello, everyone. Hi, all, and thank you so much for coming. My name is Charlotte Langer, and I will be the moderator of this panel debate. I am a consultant and entrepreneur focusing on women's health, and I also led the political effort for the Danish Chamber of Commerce this year. And today I lead the largest group of women investors in Europe at Angela Invest, where it's women investors investing into women's health. And I'm so glad to see all of you here, because this weekend we heard many talks and panel debates about female health, about fintech, and there's a reason for that. It is that innovation is really growing in this area, and consumers are starting to demand better information. They're starting to demand more innovative solutions, and that's great, this growth we see in the private sector. But at the same time, in women's health, we are facing a unique challenge, and that is the research data gap. The research data gap is basically that we lack data and research on women's health and the female biology. It was first in 1993 that the FDA in the US allowed women in the fertile age to participate in clinical studies. And yeah, for that reason, we have this gap today. So I'm excited that today we're going to discuss what can you do from a political side, from the government side, to address this challenge we have in women's health. And to discuss this question, we have two amazing panelists here next to me. We have Henriette Sverre Nielsen, professor at Copenhagen University, and Annette Stenberg, CEO at Medican Valley Alliance. And they have different backgrounds, so we're going to have different perspectives on the question today. And yes, Henriette and Annette, will you start with giving us an introduction to yourself and how you work with women's health? Maybe Henriette, will you start?
Yeah, thank you very much. I've been looking very much forward to today. I work as a doctor in the clinic, see women not every day because I also run my research group, but I have daily routines in the clinic. And what I meet in the clinic are women asking questions. And those questions has been more and more clear during the last years. For many years, it was kind of shameful to have women's problem, but now there is a clear demand for answers. The problem is that we do not yet have those answers. We are lacking so far behind, and that's what my research group is trying to do, to close that data gap based on amazing data collected throughout 20 years with Danish registries, and we have a huge possibility to close the gap if we have the political will to do so.
Thank you, Henriette. And Annette?
Yes, thank you very much, Charlotte, for inviting me for this panel. I'm heading an organization called Medican Valley Alliance. That is a member-driven organization, Danish and Swedish in this part of the world, called Medican Valley. We have about 340 companies being member within the biotech and pharma and research area. And I think in all these areas, women's health is relevant, because unless you are researching within prostate cancer, there should be an element on whatever disease you are researching within. And that's one of the reasons why we took the initiative in my organization to create a women's health network. We've been doing this for 2 years now, and the way we define women's health is not just women-specific diseases, but the entire type of health that women can suffer from and that die from, so also cardiovascular, autoimmune diseases, mental diseases, etc. And it has been quite an interest of our members, and fortunately also from a political side.
Thank you, Annette. And now you briefly covered how you perceive women's health as a term, and maybe Henriette, can you speak a bit to that? How do you see it when you work with it?
I think that we have to distinguish between two things. We have those women's health issues that are related to having a uterus and being reproductive capable, or at least that's one part of it. But then there's also all the other diseases, as Annette said, that affect women differently. And what our research has shown very clearly is that the reproductive time period is very definitive for the diseases that you as a woman pick up later in life. And that is where we really have to focus and understand that. Because we also know women live 24% more of their life in poor health. And that means that if we can fix some of these issues by knowing them, then we have an opportunity to do really, really great.
Definitely. Thank you for clarifying that also, so the audience have the context of the foundation of what we're speaking about today. And the million-dollar question coming up, why is it a political task to regulate around women's health? Is it a political task? Maybe, Annette, what do you think?
Well, it is very much a political task to regulate, because no matter what area of our life or industries we're looking at, without regulation, we're not just going to do it because it's right, or because because it's the right thing to do. I wish humans were like this, but you can see even in the sustainable or the green sector, the whole windmill industry didn't happen just by our good hearts and goodwill. It happened because we were regulating, we were giving a lot of funds to invest and research in it, we were giving a lot of benefits for companies and researchers to explore this. And we have to do this too within women's health. And in the long run, it will be beneficial, not just in terms of we will actually save lives, but we will also save a lot of costs, socioeconomic cost, if we do this. It's good business. Women's health is good business.
Thank you. And Henriette?
I totally agree. And I think the business opportunity is huge. And I think that's what has been lacking for so long. And we see this huge interest in femtech and in solutions, especially aesthetic solutions, but to really, really, really dig into understanding the biology. I think that investment is going to make those who dare do it extremely rich.
And from an research perspective, but also innovation perspective, where do you see Denmark is compared to the rest of the world? Henriette?
Yeah, I think we are lacking behind. We are lacking behind like most other countries. But I think what we have in Denmark is that we have a historical interest in improving women's health. We also have unique data. We also have a very good innovative incubator surroundings here. So I think we have the best possibilities to actually be front runners in this. But we have to say we are lacking behind.
And how do you see Denmark's position right now, Annette?
Well, I can only concur that we are lagging behind. If you look at all the prerequisite we actually have for investing and focusing on women's health, we are not doing very much right now. On the positive side, I can see there is a momentum amongst politicians and in the debate that you hear more about it. So that's the first thing, that people actually start taking this serious. And one thing I found was really, it was a small thing, but to me a very big news was about 2-3 weeks ago, the Danish Medicines Agency decided they were going to do a study on clinical trials and to look into the diversity in clinical trials. That at least there's some kind of recognition that maybe we don't have that data, and maybe we should have that data before we can move on.
Yeah, and things are going on in the political environment in Denmark right now. We see parliament members getting an interest in this area. We see the conference at Christiansborg before summer. So if it's up to you, in 1 year from now, what is the first political action you think we should take in Denmark, besides what you already mentioned there, Annette? Yeah, maybe
I would love
Henriette.
to say,
Yes.
what if we, in 1 year time, I think we should have across different political parties, we should see an institution that research women and reproductive health. So we can get those data, and it is using data that we have, quotates the whole set, and make sure that we use them for this purpose. And for that, we need a dedicated strategy. And I would love to see Denmark take a lead on this and bring that into make the infrastructure, because things are there to put into the infrastructure.
It's hard for me to disagree with Henriette on that. I really hope, and we will support it all the way we can. But there's one thing I'm also very eager to engage, and I feel the interest, and I hope it's really there, is the universities. Because it's not just a question of companies starting to focus on this and researchers starting to focus on this, but it's also to get it into the universities, so students already from the beginning, they start taking this into discussion, whether every time, whatever they focus on, that there should be also an element. Will this be relevant to do a more diverse trial, or diverse design of a medical device, for instance? So I hope the universities will join this as well. I know, for instance, at DTU, they have decided to have a dean of diversity. I think that's really interesting. I know at KU, Copenhagen University are also interested. So this is one of the things I would love to see the universities maybe push even more. And we'll be there trying to nudge them to do so.
I know she will.
Yes.
But I also think that we see the students, they walk the talk. And they want to do this. And we just had an advertisement for a position for doing data science in women's health. And we had more than 170 applicants for this position. And to me, it's just showing that, you don't have to be in an environment where it's women's health, but we see so many strong candidates coming and asking to get a job within this.
I think we have to underline this is a position in the public sector. So it's not a high-paid position. That person or these people, they could go out to some of our very strong pharmaceutical industries that are crying out for these profiles as well. But still, I think it really tells a lot that there are a lot of young people who are doing it for the cause and not just for the money.
And what about from a research perspective? Would you like to see dedicated funding to women's health, or what is your perspective on that?
And that's what we have tried and cried out for more than 20 years, that is needed. And I think, the potential is great, but we cannot underestimate how big an effort that's needed research-wise to catch up for decades and decades and decades of not investigating. And I still have colleagues in cardiovascular disease, in liver disease, that are not really understanding the data gap. And we see it when we go to the big journals and want to publish our results. It's like, this is not as good as, no. But even you have big journals coming and saying, we have a theme, we want to do women's health. And still, they have so much difficulties to really say, okay, we take something that's on a lower level and still publish it. Because that's the reality that we face. And that's what's really taking efforts now to try and change that.
And how has it been with funding for some of your own research projects within women's health?
It has been a very long and a very, very, very tough way. I can just say it took me 37 applications to get my PhD project in pregnancy loss. I have been spending since 2013 on getting money that we got in 2020. So it has been such a long, long, long way. And I think we cannot underestimate the need for research money.
No. It starts with research, right? Research fosters innovation.
And data is what we should have before we could do anything.
So now we have talked a lot about the status and the challenges we still have. Maybe on a more positive note, let's talk about and elaborate on the potential we see in Denmark and what opportunity this actually is. Maybe, Annette, do you have what are your thoughts here? How is Denmark positioned to be a women's health hub?
As I mentioned before, we have all the prerequisites in this region to actually do something about women's health. When you look at the international rankings, Denmark tops are definitely between the top 3, if not top, on the most innovative country to do business in, the best country to do business in. We are high on sustainability, and we have a very high also on gender equality. And then at the same time, we are very, very strong life science nation with strong universities. So all that combined, and that's needed. It's really important that we have these, what we call triple helix collaboration strongholds within the private sector, the academia, and hospitals. And we have that in Denmark. So it's just like, if we are not to do something about women's health, who should?
And what do you think, Henriette?
I totally agree, and I think we should be extremely grateful also that we have all of this here in Copenhagen, and now we just need to mobilize all the young people. We need to mobilize the political scene, and then we need to, we really, really need to move there.
Yes, and maybe in the Nordics we have a quite unique healthcare system. Is that a positive or a negative? How does that influence, you can say, our position to be strong in women's health?
Yeah, that's actually, I think, a little tricky question.
Okay.
Because if we want a lot of startups in Denmark within health areas, then you can say, why should that be in the private sector when you actually expect to get the answers in the public sector? And I think that is what we face for some of the startups that comes in Denmark, that we are not the best country to showcase the potential because we are not used to pay for healthcare.
Well, I believe that if the Nordic countries joined up, we could do a whole lot together, because these rankings are told about high really rank on sustainability, innovation. That goes, and gender equality. It goes for all the other Nordic states. Actually, the other Nordic states are ahead of Denmark when it comes to gender equality. But so I wish we could join together. And my organization is half Swedish, half Danish. We're trying to do that. They are the 2 biggest life science nations in the Nordics. But I think Denmark has the option maybe to even be front runner here and drag the train, because we are the biggest life science nation of the 5. But there are a lot of small elements in all 5 countries, including Iceland, which you can talk about, where there are some really, really interesting research and researchers that we could draw and do something together and show the world. But the funding is needed, and we're working on that.
And how do you see, talking about startups now, how do you see the level of innovation in Denmark within women's health?
I'm very positive, and I have to say we have been working with the Bioinnovation Institute for 4 years now, where we started doing our research project. And I think, I think we here again need to say, to get true innovations, we need data. Because there is a lot of interest now, there is a lot of eager investment money out there to close the gap, because everybody can see that things that affect women, which is half of the population, it's almost 4 billion women. Okay, that is a good business case, but the data gap here is something that we need to work very, very closely around and clever around. So we cannot find the treatments unless we understand the underlying biology. And that combination between understanding data, accelerate the understanding of data, so we can see what are the disease mechanisms, and then put in the treatments. So it is, we're looking into a lot of work, but the potential is so great. And again, I cannot underscore enough that those who come first are those that will really be doing great in this.
Yeah, great business opportunity.
Yeah, well, when it comes to startup, I totally agree with Henriette. There are some great examples, especially from Bioinnovation Institute, but there are not that many examples. And there should be so many more examples within women's health. Again, the potential is really there. It's a blue ocean opportunity within women's health where women wants to buy, they are willing to buy. It's 51% of the population, and even though only a fragment of those can afford it, it's still a really, really interesting market. But I would then go again back to the universities, and the whole education system needs to start there. It needs to put the seeds into the minds of students that this is actually an opportunity, and this is not just inventing a device or a pharmaceutical product for a human. No, there's differences between men and women.
So what I hear you say is that from a political standpoint, we should do something both on the research side, but also later actually at the innovation side, at the universities. And would that be a good approach for Denmark?
I think it will be a fantastic start because right now the politicians, they are very engaged and it's wonderful. They really want to talk about it, but they're still looking for the quick fixes. They're still looking for, I think it's fantastic, the Prime Minister initiated in her New Year's speech with the IVV trials, and now you can have extra trials for a second child. Fantastic. But it doesn't solve any problem, really, because we need to find out how do we prevent the whole prevention side. And so there's no quick fix here. We need to focus on the entire value chain and not just the end product, but it doesn't fix anything.
And you two, you're both quite activistic in your work, I would say, in women's health. You really participate in a lot of interviews. I saw you in Eurowoman this month, and I know you also have been given a lot of interviews, and you speak out publicly about the challenge we have within women's health. Is there any, besides that, do you in any way try to influence the political situation? Now I'm asking out of curiosity, are you knocking on the door of parliament members, or how do you do anything there?
Yes. I am.
Yes, maybe.
Yes. Of course, we have some specific areas where we would like to focus. And we have been with the lack of diversity in clinical trial. That was one of the first ones I initiated the discussion about. Right now, it's maybe more moving towards what Henriette is talking about, making a critical mass, a center of excellence, trying to also utilize the data we already got. And maybe, I don't know if you're going to talk about this biobank that we have already. So we actually do have some data. So also we need to be able to use the data we have for maybe new startups.
Yeah, and just follow up on that, I think the last year we have focused very much on saying and trying to influence politically that we get a center of excellence for women's health, and that center should use the data. We have these really nicely collected biobanks, but we need to understand the data that's in them, put them into perspective, and make sure we get patents, make sure we get startups, make sure we get products, make sure we come out with the solutions to the women that so much need it. And they don't just need it because they're women, but we need that as society. If we want to keep our welfare state, it's not just about women, it's about all of us.
And maybe we could even add the specific biobank we're talking about. There's actually also samples from men.
Yeah.
Because having a child is a tango. It's not just a woman, it's also the man.
Super interesting. And if we look 1 or 2 years ahead, and we have established this center of excellence, and we have maybe some political initiatives, both on the research side and the innovation side, in the journey towards that, what are the risks for that not happening? What do you see, what are the obstacles in the political process towards that?
I think the main obstacle is that we are not ready to invest what it takes.
I agree. If there's just a symbolic amount of money being allocated to this area, it will not happen. I mean, we will continue the way we're doing it right now, which is the bare minimum, and then we'll see other countries overtaking us and the opportunities we could almost grasp if we put a focus on it.
I noticed that endometriosis had succeeded with quite a few hearings in the parliament. They were also they managed actually to get on the Danish Finance Act with 100,000 kroner, so not an incredible big amount. But I find it quite interesting that this one condition has managed to really crawl into the political system. Why do you think that is?
But that has very much been taken by some really dedicated people. And I think that is super important. Endometriosis is one very important thing, but there's so much more. And I think exactly what you say, the amount is not going to solve it. I mean, that is actually not giving the data that we are talking about. We need, and that's the obstacle you talked about, we need investments of a size that can generate the next Novo Nordisk, but within women's health.
Yes, I mean, it's a simple, giving 100,000 to explore a disease, it's ridiculous. I mean, what kind of research can you do for 100,000 kroners and collecting of data? And I mean, it's not going to happen. But and I think the great thing is that actually the word endometriosis has been heard and seen so many times that people start knowing what it is. And a disease that affects 10% of women, people should have heard about it. So in that sense, it has crawled up on the awareness agenda, and I think that's brilliant. But you definitely need to move to the next step, and you take it seriously and start researching more about it.
And because this talk was postponed a bit, I just have to check with the time because, sorry, how much time do we have left? Okay, well then I think we have 9 minutes. Great. Sorry everyone, but I just had to ensure we had time enough for questions from the audience. I think I'll have one last question to wrap it up, and then we'll open up for the audience. So with the audience we have here, I think it's a quite broad and diverse group. Do you have any key takeaway when it comes to women's health and maybe what one can do as an individual if they are keen to know more and to also help this awareness we're getting in society? Do you have any key message you want to say?
I think my key message is data, and it will be so. So it's also, if you're there, join studies when you can, because that's what we need. And we actually see a huge interest from women when people think, and I have heard that many times when I've got funds, asking for funds applications, that you cannot get women to participate in this. And then we have 80% of all we ask would say yes. So I think that's exactly proving that women are there to help, and I just want to say continue that, because data is what's going to help us here.
Great. And I actually have just a follow-up quickly on that. How do you join studies? Because I would been quite eager to join a study, but I'm like, on a website, where do you look for people?
Forskning Nu
Okay.
is a website where you can sign up for different studies and where most studies are, and also social media would. That's what we ask for now when we ask for ethical permissions also.
Great. Thank you, Henriette.
Well, for me, it's very important that, of course, women are aware of this, but also men. And again, I will stress that women's health is not just the women-specific diseases, it's all diseases. The fact that women have different symptoms, for instance, cardiovascular diseases, the fact that women within lung cancer get often diagnosed way too late. There are a lot of diseases that men also get, and unfortunately that all of us die from. They affect women differently. We have different symptoms. And that's very important both for women and men to be aware of. So the awareness for the individual, I think, is important. And to talk about it with one's friends or one's family, so they know that symptoms can be different in case of a heart attack, for instance.
Thank you for sharing. I think those are some super good and useful, actionable points to take away. So, audience, thank you for the patience. Do you... let me take it.
So it's kind of a two-faced question, but my question is, isn't this just another thing that's equality-wise a problem, like the value of women? So isn't it just that? Because you talked a lot about, you know, this is a business opportunity and you can make all these kind of money, but isn't it just also the, you know, the valuable about women's position in society? And the other part is how do we go about this without making it another buzzword for equality? How do we really make it a serious, you know, change without being it like a greenwashing kind of project? Do you get my point? So it could be like psychological safety is within, you know, how do we approach work environment, but it's kind of also a buzzword in a way. So we want to work with this in a serious matter. I hope it makes sense. Does it?
Yeah.
Maybe let's start with the first part of
Yeah,
the
yeah.
question. Any of you wants to?
Well, I can definitely say especially when I talk to politicians, but for that matter also investors, I'm trying to talk about general diseases or talk money or how much loss of workforce we're leaving, because right now we are lacking hands, we're lacking talent, and if you can say that if you focused on these diseases, then we will have more people in the workforce. We are losing a lot of women, but it doesn't matter whether it's a woman and a man, if we are losing a lot of talent in the workforce. And that is one of the biggest challenge we have politically right now, is the lack of hands.
No.
Thank you. And I think for the health equality side, I think that is what this is about. And I totally agree. And World Economic Forum put out their report together with McKinsey Company in Davos in January this year, where they say it takes 131 years before we get equality. And the main driver of that is the lack of knowledge about women's health. So I think it is a very good way to start, to actually put the effort to understand women's health, because that's where the problem lies. And yeah, it should not be a greenwashing strategy. We need to be clever about it. And that's why I come back to data all the time, because I think that's the only way we can solve this. That's what has driven all the other diseases. And now we can look at Novo as the example, but that is data-driven. It's understanding the underlying biology. And if we do that here, that is the way to close that gap. I don't see other ways.
Thank you, Henriette. Does this microphone not work? Or? No, it works. Oh, okay.
Yeah, just quickly, here's a thought bubble, okay? We hear a lot about personalized medicine and the N of 1. Can't we just see female health as just a step along the way to personalized medicine, and make sure that we don't lose the battle by making it a woman's issue, because it's not a woman's issue. And by the way, women's health, particularly when it comes to reproductive health, is affecting all genders. Whatever chosen gender you are is affected by the health of reproductive health of the people in our society who can actually bear children. So I think we should tag along with this personalized medicine, because that's what we're talking about. We're talking about individuals are different, and how they express disease and how they should be treated for disease, and prevention of disease has to go down to the level of individual, frankly.
Okay, just to follow up on that, if we look at it through the lens of personalized medicine, I totally agree. We need a lot of data, we need a lot of studies, but we also need to remember that women are wonderfully diverse. So what's the initiatives need to be in place to ensure that we are not sort of reproducing what was done to women along the gender lines previously, and then only getting data on a select group of women? How can we ensure that? I think it's important that we also remember that women are wonderfully diverse, and maybe, as Karen said, think more along the lines of personalized medicine and general diversity.
So I'm just going to grab the mic so you also have a speaking opportunity.
I totally agree, and that's super, super nice points, that we have to do it as personalized medicine. But what I'm afraid of there is that if we do that, we still ran into what I meet. I mean, it's just a few months ago that I asked some people who had really exciting findings how it looked according to menstrual cycle. And they didn't even test women. So, we have to remember the women when we talk about personalized medicine. But I agree, in fact, it comes down to personal medicine, and that's the whole thing. and also the diversity within. I think that is so important, and we are not diverse enough in Denmark to really capture that in our research. But we looked into the genetics of the population we have at Hvidovre Hospital, where I'm, and it was so nice to see genetically that more than 20% of the women we include in our trials are non-Dane. And I really like that, because I think that's what we need. We need to understand this as a global issue and address it as a global issue.
Mm. And Annette, do we need the term women's health? Why can we not just call it personalized medicine?
But again, we could do that, but we're not there yet. And of course, the US is the country to look to when we really talk generally diversity, and they are also the ones the furthest ahead in this area. Also, regulation-wise, as we started talking about, where EU is really lagging behind. So I think, yeah. But I'm not a researcher, but I can see the challenge with not being diverse enough, not having enough numbers in a country of 6 million people. But of course, the aim is, the target is personalized medicine. Yeah.
Thank you. And maybe we have, do we have time for a few more questions?
Yeah. Hi. Okay, I've never tried this before. I'm a GP, practitioner læge, and I in my everyday I go about treating men and women, of course, and I don't see a lot of differences in the effect of the treatment that I'm giving. So if I want to up my game towards the female diseases, which are different than the men, and the symptoms, which I'm maybe not aware of, what do I do to be more aware of those in Denmark 2024?
Maybe Henriette, will you?
Yeah, but it's a super good question. But what we have seen and where the data point is that, for example, when women come with cardiovascular disease, we know there's a disease, there's a time lag, because they present with different symptoms than what men present with. And I think that's what has to be the curiosity in general practice, to see, okay, here comes a woman with some complaint, and it might not be the traditional, because what we know from the textbooks that we all went through was based on males that were put into those trials.
And maybe we had a question up here. If we can we get the microphone?
Yeah, so all research is funded very specifically. And of course, it's a very important thing to have a message to the politicians about women's health, or personalized medicine, if you want to call it that. But all the funding is going to come to very specific applications, which is within cardiovascular disease, in a particular cardiovascular disease, in a particular part of the body. Very, very specific things that are funded. And they can be funded for curing women, for their purpose, for the purpose of curing women preferentially. But it has to be on that level of specificity, not women health, for actually getting the funding agencies ready to put money into this.
And I agree with you, because that's how we have been able to get money so far. But I think what we have tried for some years now is also to get like a basic research institute, these grundforsknings chunks that you can get, because that would be able to then drive a more dedicated, forced effort to bring data together.
And I also guess you can, to some extent, affect what study or what research are being, what money are being applied for, what research, if you like, make a strategy from the government.
Yeah.
I guess I'm not a
exactly,
expert
but like, for example, it was not. It's very recent that we have seen the impact of reproduction on women's cardiovascular disease, and if women are not including cardiovascular studies, then we kind of lack that interplay, and therefore going for a specific cardiovascular call, you can then point to we need to study at this time point.
That makes sense.
Yes, I actually have a question regarding priorities from the government, not only from the Danish government, but internationally, I guess, because we cannot solve the problem just in Denmark. I think that would be very difficult. So because, yeah, as you also mentioned when you spoke, like in the end, it is about money. And when you prioritize an area, you have to deprioritize something. And I agree that this is not just a problem for women, it's a problem for society in general. So my question is, like, how do you find this balance? Like, do you have a concrete proposal for how to prioritize women's health? Do you see, my question is, do you see a general thing or an area where, you know, that this is prioritized over women's health? I know it can be a bit controversial to answer because all health is important. But I don't know, do we have to rethink the way that the government sees this problem? Like, how do you actually prioritize? Because it's always, you know, when you take money from something, you give it to another area.
And that is the difficult thing. When you sit here and say we should focus this, what should we then not focus on? That's exactly what you're saying, and I think the overall answer to that is fairness, and to be fair, what we see in obstetrics and gynecology, which is where we treat women during their reproductive lives and also after and before, but focusing on women's health, what we know there and the answers we can answer are so far behind. And in that fair perspective, I think it's fair to say that there should be some money given here, or not given, but invested. We need to frame that differently, and it is investments. And if we do it smart, we have the potential to actually get lots of money back to increase money in this society. If we can keep going for the welfare model, because we can create companies based on the knowledge we get here, at least we can hopefully get the money that would then enrich us to put even more effort into it.
And Annette, do you have a last comment or note on that before we say?
Well, I think very much the fairness, the fact that if you apply, if it's a cardiovascular research you wanted to do, then you could demand that there should also be an angle or focus on how women are acting in this situation. So basically, like I said, almost no matter what you research, there could be, maybe there's not, but there could be. You should definitely focus on the women's side as well. But yes, where should you take the money from? Well, a lot of the times you can actually make a business case that in the long run it will save lives, it will save work hours, it will save people from the, not being able to work and being a cost for society instead of contributing for society through taxes. So there are business cases on it, but then again, if you are to do that for women's studies, you should be that for men's studies as well. So basically all studies should just include the element of looking at how women react as well.
Yeah. So women's health and political action, it's a question of fairness. That almost sounds like a segment. But thank you so much, Henriette and Annette, for coming today as a panelist, and for the audience for showing up. It's been really great. Thank you.